This is the Fix Your Sciatica podcast.
It is that time of year when I revisit the subject of what is sciatica and the actual steps on how to recover from this pain. Now, year over year, I actually accumulate even more knowledge and wisdom to help you listeners. And so over the next 6 weeks, I'm actually going to be sharing with you the exact and effective strategies for you to recover from sciatica pain. Whether this is going to be new to you or you've been dealing with sciatica for a long period of time, it's actually time to take out your notebooks and take action on your recovery. So here's what to expect over the next couple weeks. Today, I'm actually going to be sharing with you the anatomy of the sciatic nerve and the differential diagnoses to differentiate and determine the causes of your pain. The following week, we're going to talk about how to measure progress, which is an extremely important topic to determine if you're improving or making changes. Week 3 is we're going to talk about what is called the directional preference model of pain relief. Week 4, we're going to cover the specific stretches for sciatica relief. Week 5, we're going to talk about exercises to strengthen when dealing with sciatica pain. And week 6, we're actually going to discuss how to live a life without fear of a flare-up. It's going to be an action-packed couple weeks. So let's hop right into it and talk about today's topic, which is going to be what exactly is sciatica. Now, sciatica itself is going to be the irritation of the sciatic nerve. It is a description of a specific scenario. Now, the sciatic nerve is actually one of the longest nerves in the body. It starts up at your brain, travels down your spinal cord through your spinal canals, aka your spine. It exits your spine at the levels of L4, L5, S1, S2, and S3. Now, what exactly is a nerve root? Because these things I just said, L4, L5, S1, S2, and S3, these are spinal levels. But a nerve root is actually when a nerve branches off of the spinal cord and exits your back between specific vertebrae. Those 5 nerve roots then actually converge right above, above the piriformis, which then actually forms into the sciatic nerve that runs down your. Depending on your anatomy, the sciatic nerve may actually run above, directly through, or below the piriformis muscle. The nerve then actually runs down the back of your leg between your hamstring muscles, and then it actually splits into 2 nerves at the level of your knee, behind your knee actually, the tibial and fibular nerves. The tibial nerves actually run down the back of your lower leg and then runs around the middle ankle bone of your foot. The fibular nerve actually splits into the superficial and common fibular nerve, which supplies the lateral ankle, front of your shin, and the top of your foot. Interesting fact, the inner ankle is actually supplied by what is called the saphenous nerve, which is not a branch of the sciatic nerve itself. Sciatic nerve irritation is going to often present itself as pain, weakness, or numbness and tingling along that sciatic nerve path. That means at your hamstring, inner thighs, calves, shin, and feet. Again, the saphenous nerve actually covers the inner ankle, inner calf, and the big toe. If you were to imagine the length of running from your head down to your toe, you're going to notice that there are many structures that can actually impinge on the nerves that actually make up the sciatic nerve itself. And one of the most common areas for sciatica pain presentation is happening at the low back, also known as the lumbar spine. And in the low back, we're looking at 2 main structures, specifically if your back is involved: the spinal discs and the spinal foramina. Your lumbar discs sit between each vertebrae and act as a cushion and a fulcrum of movement. The disc itself is actually a gel-filled like onion. They call it like a jelly donut. And over time, just like any other structure in the human body, the discs will actually start to wear down as we age. But in some cases, they can wear down so much that there can be a bulge or herniation in a disc. Think about a bubble that forms that pops out of a rubber tube. And sometimes that bubble can push out and can directly press on the spinal cord, which is what we call central canal stenosis, or it can push back and towards one side, usually towards the side of pain. You can usually diagnose herniated discs and bulging discs through MRIs, magnetic resonance imaging. But here's the thing, there are many people who have herniated and bulging discs without any pain at all. So the key when it comes to confirming if your disc is in fact the cause of your pain is assessing it clinically, or how do your symptoms behave based on specific motions. This is something that you should continue to take with you moving forward. Identify how do your symptoms behave. If your body prefers standing over sitting or possibly leaning to the side of pain, then you're probably dealing with a lumbar disc herniation. Another common area for sciatica pain would be through a narrowing of the spinal foramen. This is an opening that actually sits between your vertebrae, which allows the nerves to exit and form the sciatic nerve. In some cases, due to posture or behaviors or just life, this hole can narrow. As a result, it can result in a bony pinch that leads to irritation of the nerve roots that lead to sciatic type of pain. This can be diagnosed via MRIs as well, but you need to look at the clinical findings. So if you prefer sitting or leaning away from your pain, then you may be dealing with more of what we call spinal stenosis. Now, the sciatic nerve only supplies the lower leg. So if you're dealing with back with radiating leg pain, but it actually skips the butt, then you're most likely dealing with an issue in the spine that is also impacting the sciatic nerve. But if you're feeling butt pain and leg pain, then you can actually move down the kinetic chain and look specifically at the glute area. The muscles primarily we're looking at would be the piriformis and glute medius muscles. They can get irritated due to being overstretched or super tight. And you can tell if your glutes are really tight if you can cross your leg over the other without an issue. As in, if this is the case, you're going to be dealing with an overstretched muscle which feels tight, and strengthening that muscle can help. But if you cannot cross your leg over the other, then you're most likely dealing with a true set of tight hips, which can truly benefit from stretching. We'll talk about this a little bit more in later episodes in regards to how to determine if a muscle's tight or short and then what to do about it, so stay tuned. Other reasons as to why you would feel sciatica-like symptoms could be an impingement at the hamstring or the knee. We would need to do a full assessment of the lower leg to see how it impacts your symptoms. Again, how does it move and how does it change how you feel? You can also get nerve irritation from things like neuropathies, which can happen due to chronic inflammation, mineral and vitamin deficiencies, and there's been some cases in regards to sciatica related to endometriosis and even COVID-19, and these articles can actually be found in the show notes. One of the most common misconceptions about sciatica is that it all comes from one source and that there's a best exercise or stretch for sciatica. As you've just learned, there are many areas in which sciatica can be caused by. So be wary about posts and videos that say this one stretch will help with your sciatica pain, because we need to properly address sciatica pain at the source, because the source of pain will actually tell us exactly what needs to get done. And the reality is that MRIs, although helpful at diagnosing cancers and fractures, are not the best at diagnosing what the cause of the pain is. In fact, it's going to be based on your clinical presentation or your symptom behavior, which is going to help us understand what to do next. Speaking of which, the next week we're going to be talking about specifically how to properly measure your progress. I wish sciatica pain can be turned on and off just like a switch. However, that's not the case. More often than not, you're going to notice that sciatica pain behaves more like a sliding scale. And if there is going to be degrees of improvement and degrees of negative progress. And we're actually going to be talking more about that next week. If you have any questions, email us at info@ifixyoursciatica.com and I'll be happy to answer it at an upcoming podcast.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.